Hello viewers, we are about to start discussion on another disease topic, stroke or cerebrovascular accident, which is the medical name for what we all know as stroke. We have looked at a number of disease conditions already. The video presentations on these disease conditions are on my Facebook page at Bernard's Primary Healthcare Media. Kindly visit the page and watch the presentations on those videos and learn something. You can also visit my YouTube channel at Bernard's Primary Healthcare Media and watch the presentations on various disease topics over there. Kindly support my effort by just clicking on the subscription button on my YouTube channel. Well, I'm still your primary or preventive healthcare advocate, Bernard Agbonoshi, the founder and the director of the health organization Bernard's Preventive Health Education. I'm also the author of the public-friendly medical book titled The Role of Public Medical Knowledge in Disease Prevention and Treatment. I am a nurse clinician and I work in one of the teaching hospitals here in Ghana. Now let's get to the main topic, stroke or cerebrovascular accident. The question is, what is the general view of the public on stroke or cerebrovascular accident? I am in Ghana, and so my response to this question relates to my observation or assessment here. I would say most people here do not really know much about the disease stroke or cerebrovascular accident. A lot do not really even have local medical identity to this disease condition, but it is one of the commonest diseases you can find over here in Ghana. I believe this could be one of the reasons why people in our communities, many people in our communities see stroke as a spiritual disease or attack when it occurs. Stroke is one disease that occurs suddenly with little or no warning. I'm talking about massive stroke. So it is very common to see the loved ones of stroke patients blame others as the cause of the disease. For instance, one can blame a colleague in the office as the one who caused the disease. Oh, this man doesn't like him. He wants to take over his position, so he caused him the disease, stroke. Some also blame family members or friends as the cause of the disease because they see it to be an unusual kind of disease. How it occurs suddenly, I believe, how it occurs suddenly makes them see this particular common disease condition as a spiritual disease or attack. The question is, what is really stroke? When we say stroke or cerebrovascular accident, what is it? Before I move on with what it is, let me say this. We have the motherboard of computers. The motherboard controls everything the computer is able to do. We can liken the brain to the motherboard of the entire body. It controls all human abilities and activities. This means that any damage to the brain is certainly going to affect the personality, the capability, or activities of the affected individual. This brain has many different parts or components which control specific human ability or activities. For instance, there is a portion of the brain that controls the ability to read, speak, swallow, move the left hand, the right hand, or one part of the entire body. This means that individual specific ability or actions could be lost if that part of the brain responsible for it is damaged or develops some form of problem. For the purpose of easy flow of understanding, let me make these points clear here. The huge body has cells as its basic unit. Billions of cells come together to form the body, and these cells or group of cells, that is tissues, are living. They have life in them. They actually need food, nutrients, and all other life essentials such as oxygen to function. That is the reason why we always have to eat food. The body converts the food we eat into forms such as protein, carbohydrate to enable the cells or tissues to use them. These converted food nutrients are loaded into the blood and flow through veins and arteries as carriers to all parts of the body. The brain cells, by nature of its heavy function, require a lot of energy from the food that we eat and other life essentials, including oxygen. So any form of disruption of blood flow to the brain can damage it. Yes, anything that disrupts the flow of blood to the brain can cause brain damage. If sufficient blood is not getting to the brain, it simply means that the brain is not getting sufficient amount of food nutrients, example, glucose and vital oxygen, because these food nutrients and other vital life essentials are within the blood. So if the brain is not getting sufficient blood or sufficient blood is not reaching the brain, it means that it is also not getting sufficient food nutrients such as glucose to function. The brain cells are living entity and they can die off as a result. In simple terms, stroke or cerebrovascular accident is damage to the brain, leading to some form of disturbance in human activities or capabilities. So that is what we mean by stroke. A person suffers stroke when there is damage to the brain cells, leading to changes in the normal activities or capabilities of the affected person. The question is what could cause that kind of damage to the brain, leading to all these problems? Well, there are a number of factors that can cause some form of damage to the brain cells. There are three main types of stroke, and we have them from these factors that can lead to brain damage. So let's move straight to the types of stroke and thereby get the explanation for the factors capable of damaging the brain. The three main types of stroke. One, we have hemorrhagic stroke, ischemic stroke, and transient ischemic attack. These are the three main types of stroke we have: hemorrhagic stroke, ischemic stroke, and transient ischemic attack. Let's take a look at each of them. What is ischemic stroke? Ischemic stroke occurs when there is block of blood flow within the brain. The block of blood flow within the brain can occur when blood clots or fatty deposits or any other bodily element block artery within the brain, disrupting the flow of blood. This can result in this type of stroke, ischemic stroke. There are two ways disruption of blood flow, that is the block of blood flow, can occur within the brain. That is, the arteries can be blocked, resulting in this type of stroke. We have what we call embolism and then thrombosis. Embolism and thrombosis are similar, but they are not the same. With embolism, the substance which we call emboli can travel within the blood from a far distance part of the body, for instance in the legs or in the lungs, get into the brain and then block artery over there, disrupting the flow of blood. That is about the embolism. The substance which we call the emboli can be clot of blood, it can be fatty deposits, it can be bubbles of air or any other element which can travel from any part of the body, get into the brain, block artery there, resulting in this type of stroke. With the thrombosis, it is mainly about blood clots, which we call thrombus, which can occur within the brain, block an artery, also resulting in this type of stroke, ischemic stroke. The next one is hemorrhagic stroke. Hemorrhage simply means bleeding. So hemorrhagic stroke is when there is bleeding within the brain or its surroundings, when blood vessels they rupture. We have two types of hemorrhagic stroke depending on the area of the brain where the bleeding occurs. So we have intracerebral hemorrhage and subarachnoid hemorrhage. Intracerebral hemorrhage occurs when an artery ruptures, making blood to fill the surrounding tissues of the brain. And then the subarachnoid hemorrhage occurs when artery within the brain ruptures, making blood to flood the subarachnoid space. Subarachnoid space is the space or the area between the brain and the protective membrane covering it. There are three ways blood vessels in the brain can rupture, leading to hemorrhagic stroke. We have aneurysm. Aneurysm is when a weakened portion of the blood vessel balloons, making it to rupture. This can lead to hemorrhagic stroke. The second one is malformation of blood vessels within the brain. When there is malformation of artery within the brain, it can rupture, leading to this type of stroke, hemorrhagic stroke. The third one is hypertension or persistently high blood pressure. Uncontrolled high blood pressure can cause tiny blood vessels within the brain to become weak and then burst, leading to hemorrhagic stroke. Let's look at the last main type of stroke, transient ischemic attack. Transient ischemic attack is considered a mild form of stroke. The first two we have looked at are serious forms of stroke. In fact, transient ischemic attack is considered a strong warning sign of massive stroke. I'm talking about the ischemic stroke and hemorrhagic stroke. A person who experiences transient ischemic attack is likely to suffer either hemorrhagic stroke or ischemic stroke. The word transient means briefly or not lasting for long. So a person with transient ischemic stroke experiences brief neurological deficit. So these are some of the signs and symptoms associated with transient ischemic attack, and these signs and symptoms are strong warning signs of either hemorrhagic stroke or ischemic stroke, as I said earlier. One of the cardinal signs occurs on the face. There can be drooling or dropping of one side of the face when the person is smiling or talking. Yes. So when you see that all of a sudden somebody around you begins to have that kind of dropping of face when talking or smiling, then you have to suspect that the person is experiencing transient ischemic attack. When the person is talking, you realize that one side of the mouth is dropping or is drooling all of a sudden, which is not intentional. Then you have to quickly send the person to the hospital for further examination to be done to make sure that it is not transient ischemic attack, because that could be the case. Another cardinal sign occurs in the arms. So one arm can drift down when both arms are raised equally. Yes. Another area where the signs can be shown is in speech. The victim can experience slur speech. So when you have someone around you all of a sudden begin to slur in speech, please, it is not funny. you have to consider that the person might be experiencing transient ischemic attack. Other signs and symptoms include sudden confusion, dizziness, difficulty in walking, severe headache, and vision problem. So if you begin to experience these signs and symptoms, sudden dizziness, you are experiencing headache, please do not go to the drugstore to buy paracetamol and sleep. It might be that the person is experiencing transient ischemic attack. This is one of the reasons why I always say it is wrong to treat signs and symptoms at home. When you are having headache in itself is not a disease. When you are having pain in any part of your body, the pain itself is not a problem. There is something that is causing the problem, which is the sickness, and you have to uproot it in order to take away the symptom, the pain, the headache. So when you begin to have persistent headache, when you all of a sudden you begin to experience dizziness, please do not sit at home and try to treat or manage. Kindly visit the hospital for medical personnel to examine you and see exactly what it is, because you might be experiencing a transient ischemic attack, which is a warning sign of massive stroke. Let's look at another major area of the topic, paralysis. One of the main effects of stroke, massive stroke, is paralysis. We have different types of paralysis associated with stroke. One, we have paraplegia. Paraplegia is the loss of function starting from the waist down to the rest of the body. So a stroke patient who has paraplegia will not be able to move the waist. He or she will not be able to move the two legs. Another paralysis with stroke is monoplegia. This type of paralysis occurs in only one of the limbs. We have the two arms, the two legs forming the limbs. So the paralysis occurs in only one of them. So it can be only the right arm, and then the rest of the limbs, the left arm, the lower limbs, the two legs will be functioning, but the person will lose control over that right hand, the affected right hand. It could also be only the left leg. Then the right leg and the two upper limbs will be functioning, or the person will be able to use the two upper limbs. Another form of paralysis is diplegia. This type of paralysis involves a loss in function of two limbs, the same limbs. So the person, for instance, will not be able to use both arms. Paralysis occurring in both arms, and then the person will have control over the two legs or the two lower limbs. Or it could also be the paralysis occurring in both lower limbs. The person will lose control over the two legs, but the two arms will be functioning. That is what we call diplegia. The next one is hemiplegia. With this type of paralysis, the person loses control over half of the entire body. So hemiplegia, with hemiplegia, the person or the patient will not be able to use the right side of the body. The person will not be able to lift the right arm. The person will not be able to lift the right leg. It could also be the left side of the body. The person will not be able to lift the left arm, will not be able to lift the left leg, but he or she will be able to lift the right side, and that is hemiplegia, loss of body function in half of the entire body. The last form of paralysis associated with stroke is quadriplegia or tetraplegia. With this form, the patient loses control over the entire body parts. The patient will not be able to use any of the 4 limbs. He or she wouldn't be able to control the right arm, the left arm, the right leg, the left leg. There is complete loss of strength, of function of the entire body parts. I have seen a number of patients with each of all these paralysis associated with stroke. I have seen patients with hemiplegia. I have seen patients with paraplegia, monoplegia. I have seen patients with the quadriplegia associated with stroke. So this is the reason why, or this is what happens if someone cannot use a part of the body after suffering stroke. These are the things that happen when someone gets stroke and he or she can no longer use certain parts of the body. Let's look at the treatment of stroke. The question is, can stroke be treated completely? Can stroke or cerebrovascular accident be cured? Well, the answer to that is yes and no. Yes and no, because the treatment outcome of stroke depends largely on the type of stroke it is. The treatment outcome of stroke depends on the extent of damage to the brain. For instance, the treatment outcome for transient ischemic attack, which is a mild form of stroke, is not the same as that of ischemic stroke or hemorrhagic stroke, because the extent of damage in transient ischemic attack is far less than the extent of damage in hemorrhagic stroke or ischemic stroke. I have made mention in other presentations that the brain cells do not grow again. They do not regenerate when they die off completely. So treatment outcome for a type of stroke involving complete damage to the brain is always going to be very poor. So the first thing doctors seek in treating stroke is to know the type of stroke it is. Yes, that is the first thing doctors need to properly treat stroke. They can only know the type of stroke it is when the patient goes for CT scan. The CT scan of the brain will reveal the kind of damage in the brain, and that will suggest to them the type of stroke it is. The CT scan will show to the medical doctor if it is bleeding in the brain that is causing, that has caused the stroke, or if it is blockade of blood vessels in the brain that has caused the stroke. And all of these different cause of disruption of blood flow in the brain will direct the type of treatments that doctors will resort to. So it is very important that once you are told you suffer stroke, quickly make sure that you go for CT scan. Quickly make sure that the patient does the CT scan. I am saying this thing because I have seen a number of stroke patients where relatives become very reluctant. Relatives are not willing to go and do the CT scan because it is quite expensive. So without the CT scan, the doctors will not be able to determine the type of stroke it is, and they won't be able to initiate the right treatment to help with the recovery. So it is always important that people do laboratory investigation when they go to the hospital for treatment, because the laboratory investigation will suggest to the doctors directly the form of sickness that you have brought for them to initiate the right treatment on time. I have seen stroke patients who went to theater after the CT scan revealed that the patient was bleeding in the brain. The patient was still bleeding in the brain. So the initial goal of the treatment was to stop the bleeding in the brain to prevent further damage. So the patient was sent to theater. Brain surgery was done to stop the bleeding, and that actually gave a better prognosis. That actually gave a better outlook of treatment for such patients. So when you go to the hospital and the doctors ask you to do lab investigation, including CT scan, please get money and do it. It is very important to the sort of treatment that you receive in the hospital. Based on all that we have learned, I would say it is not advisable to send a stroke patient to a prayer camp or herbalist in the village for a cure of the stroke. Yes, I have seen a number of stroke patients who first went to these prayer camps or herbalists who promised them complete cure of stroke. So based on all that we have learned about this stroke disease, let us make sure we visit the hospital first when someone we know suffers this stroke disease. Yes, I believe in spiritual healing, but let us do the right thing. Send the patient to the hospital, the appropriate health facility. Let the medical professionals do their part while you trust God to heal your loved one. Do not send the person to some of these places where the disease gets complicated or it gets to a more serious stage before you come to the hospital. And by then, things are completely off hand and prognosis will not be that very good. The next relevant question is, can stroke, cerebrovascular accident be prevented? The answer is yes. Complete yes. I do tell people, we do not cure stroke. We prevent stroke. Yes. That is what I normally tell people. We don't cure massive stroke, a serious form of stroke. We don't cure it completely. It can only be managed, but we can absolutely prevent stroke. The prevention of stroke does not happen in the hospital. The doctor or the nurse is not the main person to prevent stroke. Doctors and nurses only treat or manage stroke to prevent further damage. But the prevention of stroke depends mainly on you, the general public. You, the non-healthcare professional, is in the best position to prevent stroke, because the harm happens in the house before they rush the person to the hospital. People often don't bring a loved one to the hospital with transient ischemic attack. I'm talking about the warning signs of stroke. Why? Because they just don't know. Sometimes when they bring stroke patient to the hospital, I do ask a relative, so tell me what happens. I ask them to tell me what happens, and this is what they often see. Oh, he was, first of all, they make a point that the person is actually hypertensive. The person is having hypertension, or a known hypertensive patient, but he or she defaults on medication. That is the first, most of them, that is the first thing that they see. Then after that, they begin to make mention of the classical warning signs of stroke, which are the transient, which is the transient ischemic attack that we talked about earlier on. They begin to tell you that the person gets the person suddenly became confused, the person experienced brief neurological deficits like slur speech, sudden stop when the person is expressing him or herself. They tell you all the classical signs and symptoms associated with massive stroke, but because they do not know what it is, they don't see the need to send the person to the hospital until the worst happens, which is the massive stroke. So prevention of stroke depends mainly on you, the general public, depends on you, the non-healthcare professional, because it happens in the house before they normally bring them to the hospital. So how can one prevent stroke if he or she does not have the relevant knowledge on what it is? How can one prevent something he or she does not know about? This is the relevance of this presentation that I do. Again, based on all that we have learned, there are a number of factors that can cause stroke. A direct trauma to the brain can cause stroke. For instance, a person involved in road traffic accident may suffer stroke when there is some form of damage, direct damage to the brain. But the leading cause of stroke over here in Ghana, I am in Ghana, so I am speaking from my observation over here in our hospitals, is hypertension. Yes, hypertension is a leading cause of stroke over here in Ghana. So I do tell people that, people who have hypertension but do not want to take their medication, this is what I do tell them. If you want to commit suicide and you don't want to use rope, then get hypertension and then refuse to manage it or take your hypertensive drugs to control the BP. Yes, because if you have hypertension and then you do not manage it, the next thing that can happen is stroke. And the medical term for stroke, which is cerebrovascular accident, has the word accident in it. And we know accident is something that happens suddenly, something that is not foreseen. So if you have hypertension, please take the management of it seriously in order not to find yourself with this deadly and dangerous disease called stroke. Comparably, more males suffer stroke than females. There are a number of factors that contribute to this. One of them is that men are less conscious about health. Oh yes, there are men, I will use the word, who are stubborn. They have some sort of health problem, but they just would like to ignore it rather than taking steps to take care of that health problem. And hypertension as a silent disease is one of the diseases that most men would like to take for granted. One of the reasons why men suffer stroke is that hypertension, which is also a disease more common in men than females, is not properly managed. Yes, there are a lot of men with hypertension and they are not careful to properly manage the hypertension. And stroke is a complication of hypertension. It is easy for someone to suffer stroke when he or she has hypertension and is not properly managed. Another reason also for most men getting stroke, probably from hypertension, is that they default on medication when it comes to treatment of hypertension. Many men are hypertensive and they do not take their hypertensive drugs to control the high BP. Some give reasons for not taking the hypertensive drug to control the BP, and one of the reasons is that the hypertensive drug do have some effect on their sexual drive. So once they realize that the drug is having some kind of effects, negative effects on their sexual life, they prefer not to take the drug at all. But I do say the hypertensive drug, we have different types of it. We have different types of hypertensive drugs. So if you take drug A and it's having some sort of negative effect on you, the best thing you can do for yourself is to reach out to your healthcare provider and then let them assess and then change the drug so that the one that can work for you better will be given to you. So you don't need to completely ignore taking the hypertensive drug because it was having some sort of negative effects, for instance, on your sexual drive. So hypertension is the leading cause of stroke over here in Ghana. The main reason for this is that a lot of people have the disease hypertension and they are not careful to properly manage it. Some too have the disease, but they are not aware. So you come to the hospital, someone will be diagnosed of stroke and also be diagnosed of hypertension for the first time, which means that the person is already hypertensive for years and he or she is not aware of the disease hypertension leading to its complication, which is the stroke. One of the reasons why many people also do not manage hypertension properly, which easily leads to getting stroke, is that they assume hypertension can be cured. A lot of people over here will tell you, oh, I have stopped taking my hypertensive drugs because it has been cured. Some of them will tell you the pastor has prayed for me and said the hypertensive is no more there. So even when you check the BP and it is very, very high, dangerously high, they will defend it and tell you that the disease is no more there because it has been cured. But the point is, as I have said in my presentation when I was treating hypertension, hypertension is one disease that cannot be cured. Hypertension is a chronic disease which cannot be cured. You can only manage hypertension, but you cannot eliminate hypertension out of the body in a situation like malaria, where you take the malaria drug to clear the parasite from your system and be completely free from the disease. Hypertension is not an infectious disease that can completely be cured. It is a chronic disease that must be managed and managed properly. So people have to get this understanding clear so that they will not default on medication when treating hypertension so as to get this deadly disease, stroke. So you go to our hospitals, you see very young men who are in their 30s, 40s, down with stroke. These are educated people. Some of them are office workers and they suddenly come to the hospital with stroke. So let us make sure that we have the basic knowledge on some of these determinants of health so that we take appropriate steps in order not to find ourselves in such kind of a very bad situation. Let me try and explain why hypertensive patient must continue taking his or her drugs until the healthcare provider says otherwise. You see, some of the hypertensive drugs work to make the blood vessels, the arteries and the veins clear for the smooth flow of blood. In the case of hypertension, there can be a situation where fatty deposits form within the lumen of the blood vessels, the arteries and the vein, thereby impeding the smooth flow of blood within them. So the drugs work to remove or dissolve these fatty deposits within the lumen so that the blood can flow through. Sometimes naturally the blood vessels are flexible, which allow blood to maneuver through them easily. But in hypertension, the blood vessels can become flaccid or rigid, where it makes it more difficult for blood to easily flow through. So some of the hypertensive drugs work to make it possible for the smooth flow of blood within it by reducing the amount of fatty deposits that form within the lumen of the blood, or by making the flaccid or rigid blood vessel to become flexible to make the flow of blood within them. So when you are taking the drug, this is what the drugs are doing to make the smooth flow of blood and thereby reducing the high BP or the high blood pressure. So when you stop taking the hypertensive drugs, the fatty deposits then again form back within the lumen of the blood vessels, the arteries and the veins, thereby driving up the blood pressure or the BP to a very dangerous state. When you stop taking the drugs, the blood vessels, the arteries and the veins become more flaccid or rigid, making it difficult for blood to flow through them. And this can drive up BP to a very dangerous state that can lead to stroke. I would say there are too many people who come to our hospital wards with stroke. Yes, there are too many people who come to our hospital wards with stroke, and we have to do something about it collectively. As I said earlier, the person in the best position to prevent the occurrence of stroke is you, the general public. You must first of all know what it is, so that when you are in the house, you can modify your lifestyle, you can engage yourself in activities that will improve your overall health, not to find yourself in this situation of having stroke. When you come to our hospital wards, where, for instance, we have about 30 patients on admission, it is not surprising to find out that nearly half of the patients are there with stroke. And this is not a good trend, and we have to do something about it. I am doing something about it by having this educative presentation, and you also must learn something out of it and put it into practice. Let's continue from where we left off. The next area to look at is management of stroke. I have already said something shortly about the medical management of stroke, but let's focus on the general management, the supportive management of someone who is down with stroke. The management of stroke depends on the severity of the condition. So here we will focus on massive stroke. A person with stroke with severe paralysis and other vital functions in the body gravely affected. For instance, stroke can badly influence the ability of a person to breathe. Stroke can dangerously affect the ability of a person to maintain normal body temperature. Stroke can also affect ability of a person to swallow, and many others, depending on the severity of damage within the brain. Now let's look at some of the effects of massive stroke and how they can be managed. 1. Difficulty in breathing. A stroke patient may find it very difficult to breathe on his or her own. This one is managed by putting the patient on oxygen, and it is usually done in the hospital. Another one is inability to control body temperature. I have seen a lot of stroke patients who normally have very high body temperature, and this very high body temperature must be controlled, must be brought down. If not, it could cost the life of the patient, and this is also usually done in the hospital. Another effect of massive stroke is difficulty in swallowing. A stroke patient may find it very difficult to control food in the mouth and also swallow. So when you realize that a person is not able to swallow because of the condition stroke, the first thing to do is not to put food in the mouth and see if the patient will be able to swallow or not. The first thing to do is to test the swallowing reflex of the patient before you put any substantial amount of food in the mouth. And this is how you test the swallowing reflex of the patient, by introducing small amounts of water into the mouth, and then you observe closely how the patient swallows that small amount of water. If after many encouragement, after so much effort to get the patient to swallow that small amount of water and he or she is unable to do so, please desist from putting into the mouth any other food substance or anything else. Do not put anything else in the mouth if you realize that the small amount of water you put in the mouth is stored in it and the patient is not able to swallow it. If you continue to put in more water or you introduce food into the mouth, you might cause aspiration in the patient. So how do we prevent or reduce the risk of having the patient choke on food or any other substance put into the mouth, or reducing the risk of the patient suffering aspiration pneumonia? In the hospital, there is a special tube that the doctor can pass directly into the stomach through one of the nostrils. This tube is then used to feed the patient. Because the tube is not big, the patient is normally fed fluid diet. So in the hospital, the patient is normally given light soup. The patient is normally fed with light soup, and water is also given to the patient through this tube. Oral drugs are also given to a stroke patient through this special tube, nasogastric. We call it nasogastric tube or tube feeding. If the oral drug is tablet, it is then crushed into powder, mixed with water, and then given through the tube. This greatly reduces the risk of the patient experiencing aspiration pneumonia or suffering aspiration pneumonia or getting choked. However, some stroke patients are able to swallow but extremely slow, and they can be fed through the mouth. This means that the person doing the feeding must be extremely patient. Yes, when feeding through the mouth, a stroke patient who is having some degree of difficulty in swallowing, you must be extremely patient, which means that you must introduce food into the mouth in bits. Wait patiently for the patient to swallow before getting another into the mouth. You must observe and be sure that the patient has swallowed what you already put into the mouth before you introduce another one. If not so, you might end up getting the patient choked. This is one of the reasons why relatives are advised not to carry out any form of activities on or for the patient when they visit them on the hospital wards, because you might end up causing more harm to the patient. Another major problem associated with difficulty in swallowing in a stroke patient is accumulation of secretion or saliva in the mouth. Yes, because they are not able to swallow properly or they are not able to swallow, the secretion or the saliva they produce collect in the mouth, and this can choke the patient. So the secretion must be removed. The secretion must be drained out of the mouth in order to reduce the risk of choking or aspiration in the stroke patient. So in the hospital, there is a special machine. We call it suction machine. This machine is used to suction or withdraw the secretion or the saliva from the mouth. Another way to manage excessive accumulation of secretion or saliva in the mouth is to tilt the head of the patient to one side. Yes, tilt the head of the patient, or let the patient place the head on one side. With that, the saliva or the secretion is able to drain out from the side of the mouth. The patient is able to drool, so that the saliva excess of it is getting rid of, in order not to get the patient choked. Let's look at another management area of a stroke patient. A stroke patient with severe paralysis. where he or she is restricted in bed. The patient is incapacitated. He or she cannot do anything for himself. This means that others must provide care for such patient. The care includes self-care. That means the patient must be bathed in bed. The patient must be cleaned in bed. If he or she soils himself, the bed sheets or the linen must be changed. Diapers must be changed when they are soiled. The patient must be provided self-care in order to enhance his self-image and also prevent the risk of infection. One of the major problems of a bedridden stroke patient is the risk of developing pressure sore or wound at certain parts of the body. Because a stroke patient is restricted in bed, circulation or blood flow is very poor. This means that the person is more at risk of developing sore at areas that have prominent bones. For instance, at the back or at the sacral region where you have prominent bones, it's easy for a bedridden stroke patient to develop wound in such areas. How then do we help a patient in that kind of situation? One of the ways is to regularly turn the patient from side to side in bed. Do not allow the patient to remain in one position in bed for a very long time. At most, every 2 hours, try and turn the patient from one side to the other in order to reduce the risk of developing pressure sore in such areas. Another management is to prevent or reduce the risk of the patient developing clots at the lower extremities, especially at the lower extremities. Again, because the patient is not able to move and always lying down in bed, there could be the risk of sluggish flow of blood throughout the entire body, especially at the lower limbs. So one way to prevent or to reduce the risk of blood clot forming and then cause major harm, another major harm is to put on what we call TED stocking. TED stocking is a special sauce, very long special sauce. The full name is thromboembolus deterrent. It is a special sauce that is very elastic. You put on the leg, the entire leg of the patient, which then improves circulation at that section of the body in order to reduce the risk of blood clot forming. And we already talk about the types of stroke which can be caused by blood clot forming at a far part of the body, traveling within the blood to the brain, and then block an artery there, causing stroke. So to prevent further damage, one way to help a stroke patient is to get that special sauce. I call it sauce. It is called, it's a medical special sauce that we put on patients who are bedridden and they are not moving. Try and get that sauce. When a doctor recommend or asks you to buy such sauce or such medical item, try and get it. This is the importance of it. It prevents or it reduces the risk of blood clot at the lower extremities that can cause serious damage. As I said earlier, hypertension is a leading cause of stroke over here, I would say in Ghana. Most of our patients on the ward with stroke are hypertensive. So you have to continue with the management of the hypertension with hypertensive drugs. Do not stop serving the stroke patient with the hypertensive drugs to control the high BP, which would then prevent further damage. Another way to help a stroke patient is to massage certain parts of the body. The parts of the body that the patient is always lying on. You can use a cream. You can use an antibiotic cream to massage the area, apply the cream in the area and then massage. That can also help with circulation, reducing the risk of pressure sore forming. Another helpful management plan for stroke patient is physiotherapy treatment. Yes, physiotherapy helps stroke patients a lot. So when you are even discharged on the hospital ward, the physiotherapy team do come there to assist them. But when you are discharged home and the doctor asks you to go for physiotherapy on regular basis, please, you have to go. It will help a lot. It helps in recovery a lot, especially those with not very severe form of stroke. It helps a lot. I have seen a stroke patient who recovered fully with the help of physiotherapy. So do not relent on undergoing physiotherapy. When you are discharged home and you can afford, you can engage the service of a professional physiotherapist to even help you at home. That will go a long way to assist with your recovery process. Well, this is the end of my presentation on the disease condition, stroke or cerebral vascular accident. I hope you have learned something. From all that I have said, you should recognize that the prevention of stroke depends more on you, the general public, than healthcare professionals. Yes, I have said that several times during my presentation. So we all need basic medical knowledge. If for nothing at all, you should be able to have basic medical knowledge, and that can help you to take informed decisions to prevent the worst from happening. Kindly share the videos. Kindly invite your loved ones to watch and learn something. It will go a long way to help all of us. Subscribe to my YouTube channel again at Bernard G's Primary Healthcare Media, and follow me on Facebook, same at Bernard G's Primary Healthcare Media. Thank you very much for your time, and watch out for the next presentation.